In August of this year, actually August 15th through the 21st, so it was about 6 or 7 days that I spent with an activist in Barbani city itself. Her name is Madhuri, and she is the head of JAD, which is an advocacy group in Barbani city that works all throughout Barbani district. So just to give some background on Barbani and then the fact-finding mission as it initially began and then what it developed into, I will just take a second to explain to give some context. As you can see, the population of Barbani is just over about 1.5 million people. It's has the second lowest human development index in all of Madhya Pradesh, meaning it has very low health indicators and it's considered a very backward district. The district level household survey of 2007-2008 said that 65% of pregnant women are not receiving essential antenatal, postnatal, obstetric care during their pregnancy, and the maternal mortality ratio in Barbani district or in the Indore division is 278 women per 100,000 live births. So its maternal MMR is very high compared to other states in India. And looking at the breakdown of the maternal MMR, you see that a lot of the deaths occur where women are most at the peak of the reproductive age, which is between the ages of 20 and 34. So like I said before, this fact-finding mission was undertaken on the 25th of August. I was there for 6 months with Madhuri and 2 of other activists. It initially began as a fact-finding on the implementation of NHRM and IHES in the district, and it was a follow-up to a case that actually Advocate Shano Shaguftakan and Anuva Rastogi are arguing before the Indore High Court. So we were looking at public health facilities, CHCs, PHCs, district hospitals, civil hospitals, to see, if there was adequate posting of doctors, to see if there was funding, to see if there was enough stock of medicine in the hospitals, just to follow up on whether it was being implemented as per the order that had been issued previously in that case. While I was there, though, I noticed that a lot of the facilities that we visited had family planning camps on a daily basis, and this was not during the peak season of family planning camps. This was just a general time that we went to, and we noticed that many women were waiting to have the female sterilization surgery. So it's something that I took note of, especially in consideration of the DevikaBiswas case. Of the facilities visited, you can see we visited a good number of them. There were about I think 12 facilities on this slide, and I think there might have been 1 or 2 that I had left out. But it was pretty extensive over 6 days. We visited maybe 1 or 2 facilities each day, just to get a good idea. And this is a map of Barbani district itself. We were based in Barbani, but we also went into Pansama, which is near the Rajasthani border, Sendva, Palsu. We went to a lot of the places that I actually had mentioned in the previous slide. So it was really an extensive fact-finding. Some of the major issues that we noticed, that I noticed in Madhuri as well, is that family planning in Barbani district itself and from my observations in the whole of India, is sort of a stand-in for sterilization, and sterilization itself is a stand-in for female sterilization. Most all of the time that we went to these family planning camps, I can say I never saw a single man waiting to have a vasectomy. It was always females being sterilized. These women, when asked, they were quite uninformed about other forms of contraception. They had been heard in their community about female sterilization and thought that was sort of the best, most effective means to space or end their reproductive health cycle, so that they opted for this, and having this cash incentive, they thought it would be a good idea. They were pressured, and actually not only the women getting this surgery, but also the people working in these facilities are pressured to meet their targets. All of these targets are sort of unofficial, it's not in writing, but when you speak to some of the doctors, as I'll mention in the next slide, the unofficial target is about 1% of the female population in Barbani district. And that's not, it's not only Barbani district. This happens all over India, that they have an unofficial target, and by the time, I think by the time that it reaches March of the next year, they're really aggressively pushing to meet their target. There's also, this problem is compounded by the fact that these women don't have access to other forms of contraceptives. And then there's the monetary incentive, which sort of, really makes this option beneficial to the women who think, I'll go in for female sterilization, I'll get some money out of it, and then I'll also not have to worry about getting pregnant in the future. Some of the problems that I noticed are that these facilities are very unhygienic. Many of them don't have an operating theater. Many of them don't have female doctors. Many of them don't have doctors. There's one doctor in many of these cases who was posted at the district hospital in Barbani itself, but would travel around to a lot of these different facilities, perform these family planning camps, maybe 1 or 2 every day, 4 days out of the week, which meant a diversion of doctors at the district hospital itself, but also there's no post-operative care, there's no preoperative care, so these women are taken in, operated on for at most 2 minutes, 2 to 3 minutes, and then left afterwards, and the doctor moves on to the next family planning camp. There's a lack of transportation. At one of the camps that we went to in Rajpur, women had been lined up and waiting for a doctor since about 8 o'clock in the morning, and the doctor didn't show up until 4 in the afternoon, which means that the women were sedated and then were not conscious again until late in the evening time. And there was no transportation provided to them. There was no post-operative care, as I was saying. So these women were left to figure out how to get home afterwards. They weren't given any counseling whatsoever, and they were just sort of left to figure out what to do afterwards, even though they'd been waiting since the very beginning of the day. And this isn't, again, it's not special to Barbani district, and it's not special to this facility. It's the district-wide, and it's probably countrywide. There is a lack of provision for space. There aren't any beds. I'll show you a picture in the next slide or two that shows once these women are operated on, they're carried out into the hall and laid out on the floor to recover consciousness because there isn't enough space for these women. We went to a couple of camps where there were up to 50 women who were operated on in about a 2-hour time span, which, like I said before, equates to about 2 minutes per woman. And this is not in an operating room. This is in a standard room that has a metal bed and little light. So it's a very harrowing experience just to be around, and I can't imagine that it's any less to be the actual woman who was being operated on. So this is one of the facilities that we went to. This is in Balwadi, PHC. Again, 50 to 100 women were there, and it was the same doctor that sort of travels around the district and performs all of the family planning camp surgeries. And this is just to show you that these women are all huddled in this hallway waiting to be operated on. Excuse me. This is in Rajpur CHC. You can see that the clock shows it's about 4:40 in the afternoon, and these women are still waiting to be operated on. And when the doctor reached, he had no explanation except to say, "Well, I was at another family planning camp, and I tried to make it as quickly as possible." And this is the picture that, to me, speaks volumes about the treatment of women in this family planning camp and this population policy. These women literally are just passed out in the hallway without any. They aren't offered counseling beforehand. No preoperative care, no postoperative care. In the middle of the day, and they're just made to lie there for hours on end. It's very disheartening, and it's very disappointing, and it's terrible. Let's see. So to recap, the major issues are severely unhygienic facilities, a lack of doctors, women being disproportionately targeted, especially poor women in rural areas, a lack of choice, lack of access to contraceptives, a lack of information, lack of care, as I've stressed a lot, a lack of transportation provision. I mean, these women are approached, or they hear about this operation, they go and they get it, and then they're sort of left to their own devices. And in many cases, as we found in Rajpur itself, these women complained that they never actually received the incentive payment that they were promised from the very beginning. And not only the women, but the women who were working at this facility were also very angry about the fact that they met their target or they were meeting their target, and they would never receive payment for having done so, or for counseling a woman and bringing her from the village to the CHCs or PHCs. And then a diversion of doctors. These doctors are posted to hospitals and then they're never there because they go around to the villages or to the other facilities to perform these surgeries, and so they're not actually providing the care that they're posted there to provide. And that is all. Thank you.